Good evening, everybody, and welcome to the second debate of term, and welcome, of course, to the Cambridge Union. Just a few sort of notices to run through to welcome you all to our chamber for those who may not have been here before. Obviously, as you guys may or may not know, this is the last day of our open period in which we open our chamber to all prospective members from the University of Cambridge and Anglia-Ruskin University. So, if you are one of those members considering joining or purchasing membership, welcome. Today is the last day in which membership is discounted, and that is a life membership, so that's £250 for life, so do consider that. So I'll just run you through the way that the debate will work. We have two sides, the proposition and the opposition. The first speaker on proposition will come up to the dispatch box and make an around 10-minute speech. Then a member of the opposition will come up and make an around 10-minute speech. Then we turn to you guys, the audience, and you get the opportunity to make a floor speech. That's a shorter speech that lasts around 2 minutes, and there'll be one in proposition, opposition, and abstention. There is a prize this evening for the best floor speech that will be selected at the end, and that is a meal for two at Gardy's. And by a meal for two, I mean 2 kebabs and some drinks. Those of you who are acquainted with Gardy's, it's the best kebab spot in town. If you're not, well, you need to go there. There's also the opportunity for points of information. So when someone is making a speech, you have the opportunity to sort of raise your hand on that point of information, and that can be around 10 seconds. If possible, phrase as a question. We will remind you to keep it on topic and on point, and don't go off, sort of on a tangent making your own speech, as obviously that is reserved for the paper speakers and those who make a floor speech. Okay, so the motion before the House this evening is this House would make vaccinations mandatory. The first speaker for the proposition is Harris Khan. Harris is a first-year student in Gonville and Keys, studying theology, religion, and philosophy of religion. He won the right to speak through an audition. You have the ears of the House.
Thank you very much to the President and the Debates Officer for giving me the opportunity to speak for you all here today. When I began to think about the motion, it felt obvious that there could be 2 reasons why someone may immediately oppose mandatory vaccines. One is the broad idea that compelled action should just be avoided, which is an argument that exists in line with ideas relating to the sovereignty of one's own body. The second argument relates to trusting third parties to deliver the vaccine. It is perhaps in the combination of these 2 ideas that the argument in the mind of the audience exists, and therefore it would be important to deal with these 2 ideas separately. Let us switch our examples from vaccinations to driving. You are compelled to wear a seatbelt. The logic behind this is quite simple. Were you to not have worn the seatbelt, you would be 50% more likely to be fatally injured. We, as a society, have deemed the relationship between the increase of fatality and mandatory action to be obvious and intuitive. Similarly, were you to own a car and not to have car insurance, you could get an unlimited fine and be disqualified from driving altogether. The logic behind this is also incredibly simple. Your insurance not only gives you financial protection in the event of an accident, but also protects you from claims arising from injuries to other people. Here, the idea remains. We have deemed the relationship between the increased risk of harm towards others and mandatory action to be easily understood. Therefore, the argument arising from mandatory action is flawed. We are constantly compelled to do things. Put on a seatbelt, purchase car insurance, pay our taxes, follow traffic signals, even pick up after our pets, which means that a mandatory vaccination would be no different. The reasoning behind the current imposition is obvious. They are necessary for the greater good. They help to prevent harm not just to individuals, but to society itself. Now, switching back to the topic at hand, the argument should remain slightly more obvious. Yes, you can still argue about a loss of autonomy over one's own body. Yeah.
So, these examples involve conditional. So, you'll choose to go in the car, then have to wear a seatbelt. You'll choose to buy a pet, then have to come on. Whereas vaccines, you choose to exist, you have to come on.
The difference is, if you remember to mandates regarding the COVID vaccines, that the mandatory aspect of it arrives in a slightly different way. So that could be something as like, you must have a vaccine, else you are not allowed to do X, Y, Z. And in that case, the condition would still exist. Yes, you can still argue about a loss of autonomy over one's own body, in which case people should also cry out about their loss of autonomy to drive without insurance, or drive without a seatbelt, or drive and ignore every road sign. The logic from earlier remains intact. An increase of safety to the individual and protection of the community should result in mandatory action. And that increase of safety is blatant. The COVID vaccine prevented more than 24 million infections and 105,000 deaths. If you remember our 50% figure from earlier, then a study published by the New England Journal of Medicine found that the COVID vaccine is 52.2% effective at preventing infection and 66.8% effective at preventing hospitalization. 3 doses of the polio vaccine, that's 99 to 100% effective, and historically, the smallpox vaccine has been 95% effective in preventing infection. Now, once you consider the notion of herd immunity, which can occur much quicker in a population subject to mandatory vaccination, then it is obvious that mandatory vaccinations are incredibly logical. There was a measles outbreak in Wales in 2013, which came about due to unvaccinated people passing the disease to other unvaccinated people, and thus would not have occurred were mandatory vaccinations to be implemented. It must be said that this is not some sort of knee-jerk response to COVID-19. In more than 100 countries, including all 50 states in America and Australia, there already exists some form of mandatory vaccination of school children for a range of diseases. And there is also a long history of successful mandatory vaccinations from the 18th and 19th century to New York's imposition of mandatory flu vaccines during the swine flu pandemic. In all these instances, we see a consistent commitment to public health, to science, and to community. Additionally, no major constitutional or international court has found that a mandatory vaccination violates any general right to liberty or autonomy of the body. Thus, the first argument, one that relates to compelled action, can be dismissed, and we can look forwards to trust in third parties. Vaccine hesitancy may be reasonable, perhaps by communities who have been subject to state-complicit persecution, discrimination, or neglect. And however, the solution to this is not to therefore remove the notion of a mandatory vaccination and all its benefits, but instead to engage with these groups via community-led education. For others who blanketly do not trust vaccinations on account of it being a third party delivering the vaccine, one must remind them that you trust third parties constantly to deliver you essential items. You, despite any reservations about your water company, trust that when you drink from the tap, there is, for example, not sufficient lead content within it to kill you. You, despite any reservations about the pesticides they spray on food, will trust that the food you buy from the supermarket will be fit for consumption. And the most telling part is that you already rely on pharmaceutical companies to provide medical treatments despite any reservations about the company itself.
On that point?
Yeah.
So all 3 of the examples we know they're often things that are like cited against, like children against vaccines. People do go against vaccines. People are generally against vaccines. People are against pesticides. People are against, for example. So what do you say to those people?
I think I address it just then, but if I don't, we'll come back. You provide medical treatments despite any reservations about the company itself. The obvious answer for why this trust exists is down to vested interest. The water company or the food company has a vested interest to ensure that you do not die from their water. In the same way, vaccine companies cannot allow for their product to act in an unintended way. Additionally, were a vaccine company nefariously injecting individuals with something other than a vaccine, then all other vaccine companies would have a vested interest to publish this information. This is not even to mention the rigorous standards that public health organizations uphold in the development of a vaccine. Research and preclinical trials and human trials and regulatory review and scaling and quality control all occur under unbelievable scrutiny and inspection. So much so that it typically takes some 10 to 15 years to develop a vaccine. And thus, to disagree with the notion of mandatory vaccination on account of a lack of trust is absurd. Fine. Yeah.
Can you think of no times when the medical establishment has gotten anything wrong? Can you think of no drugs that are not caused untold damage? I love your confidence in the NHS as a wonderful healthcare system. Perhaps a little bit of suspicion?
Right. I mean, in any instance in which some sort of drug is acting in an unintended way, I think it'd be safe to say, just by the sheer amount of drugs that are being produced constantly, that is an anomaly and not the rule. And so therefore I'm operating under the rule, and in any case where there is an anomaly, that should be treated as such, which is an anomaly. Yes.
You said water, for example.
Right.
I don't know if you know about the recent infection with Campylobacter that's put people in hospital. People have to rely on the water company.
Mm-hmm.
The vaccine is still a choice, and if the vaccine were going to cause deaths, so I can understand why people may not be so willing to trust.
My curiosity on that point would be, I mean, if you understand about the water company regarding bacteria, does that change your aptitude to, say, turn on the tap in the morning either? And I understand your point where you're saying that it is a choice in a vaccine, but really it is a medicine. And so in that case, if you're trying to argue that the choice is between, say, something like being healthy and not healthy, I think that choice is quite easily understood. Fine, sure. Do not trust third parties to deliver your necessities and then go hunt and gather food or build filtration systems for water and enjoy a deeply illogical and impractical life. And so, to conclude, living in a society means recognizing that our personal choices have far-reaching consequences for others. We collectively agree on rules and regulations to protect each other from harm. And so we ought to do the same for public health. Mandatory vaccinations are not just about individual protection, and although I do hope I've proven that vaccines happen to be incredibly good at protecting the individual, but they're also about the moral duty we owe to one another, especially the most vulnerable among us. It therefore is not merely a question of autonomy, but a question of solidarity and shared responsibility. The data is clear, and so is the answer. We have the opportunity to protect ourselves, our loved ones, and our communities by working towards the goals of science, logic, and common good. Thank you.